So you're very short-sighted. This is really quite common, and you do have some special things you need to consider with regards to cataract surgery. The risks of all of the ordinary risks still apply to you, but there are some specific to you. One is the lens power calculation. We have lots of calculators that are trying to work out what lens to put in the eye to try and save for distance. They're based on populations, and we have a lot of data on people with reasonably ordinary eyes who are just a little bit short-sighted or just a little bit long-sighted. When you get to people who are very short-sighted, the calculations tend to be a little bit less accurate, so we're less sure of getting you set spot for distance. It's one of those things we have to accept, and we do our best to try and work things out. I myself use multiple formulae and multiple calculations, so if you are seeing your surgeon, ask them what calculations they use. Nudge them. There is this ESCRS, European Society of Cataract and Refractive Surgeons, calculator that gives you about 6 calculations all in one. And then what I do is I pick the average of all of them to try and get you set as possible, close as possible for distance. People who are short-sighted hate being left long-sighted because suddenly you can't see anything. You do, and you will lose your superpower of being able to bring things really close up and seeing it, because your magnification effect will go. But instead, you'll be able to see in the distance, which will be a whole new lease of life. Some people don't want that though. Some people want to stay short-sighted. I think that's a waste, but in the end, it's your decision and your call. So if you do, let's say you're sort of -2.5 or -3 and you tend to read without your spectacles on, you may elect to stay short-sighted and have that again, which will mean you need spectacles for distance, but hopefully you can still read. I try and advise patients against that. I think it's much better to be able to see without spectacles and then just get some cheap and cheerful reading spectacles for your reading. There are things that can be done also to try and give you that reading vision back, but if you watch one of my other videos that discusses presbyopia and reading vision, then you'll be able to understand that. But speak to your surgeon about it and make sure you have an active discussion about where you want to be left and whether you want to stay short-sighted or not. We often use the calculation from one eye to refine the calculation for the other eye, so we see what outcome you have and then we fiddle it a little bit to try and get you set for distance. People who are very short-sighted, they wake up in the morning and they can't see anything, so this is a whole new lease of life for you. Complication-wise, the front of your eye is a bit deeper, so it makes it a little bit more technically challenging, but most good surgeons should be able to cope with that very, very well indeed. The retina is one of the major things with people who are very short-sighted. Because your eye is longer, because your eye is bigger, the retina is draped over a larger surface area, it's a little bit thinner, and there are areas of potential weakness. Retinal detachment is one of the concerns before we operate on you, after we operate on you, and forevermore. Even though we take away your short-sightedness, your eyes are still inherently short-sighted, so it's really important that you watch out for things. People who are short-sighted inevitably have floaters anyway, but if you get a sudden new onset of floaters, solid curtain across your peripheral vision, or flashing lights, you need to report it straight away, and that means go to eye casualty. When you go there, you tell them, I was very, very long-sighted before, I've had my cataracts done, I'm worried about my retina, and they need to have a good look around and make sure the retina is okay. Retinal detachment is a risk. Probably in very, very highly short-sighted people, you're probably talking about 1 in 250 chance of retina coming away. We don't know whether we cause it or whether it was always going to happen, but you've got to be vigilant for us. As long as we catch it early, we can treat it. But people who are very short-sighted often have a fantastic outcome, and there's really nothing much to worry about.